Well, hello, everybody. Thank you for joining today's Retirement Genius Brainstorm webinar. I'm your host, Chris Orestis, president of Retirement Genius, and I thank you so much for joining us. Today's topic, we're going to talk about current political affairs and economic numbers that are coming in, how that's impacting retirement today. I want to give you an insider's view. I spent years working in Washington, D.C. I worked in the White House. I worked on Capitol Hill for the Senate Majority Leader. I was a lobbyist for the insurance industry for a number of years. I've testified in legislative hearings around the country and in Washington. I've helped to write legislation that's in Washington, D.C. on Capitol Hill. I've worked in politics and been around it all my life. And want to spend some time sharing with you some of my observations on what is coming in on current economic data, the economic situation that we're all watching on a daily basis, everybody's keeping a real close eye on what's going on. If you have a 401k like me, it's probably looking more now like a 201k, but that's going to change. Remember, economic conditions are cyclical. Economies go up and they go down, and they go back up. And what I've been encouraging people all year since the economic shakiness really started to take place in 2022 is not to panic, sell assets, investments, lock in losses. You really want to do all you can to ride this out, to read the numbers, read the political tea leaves, and get a sense of what's going on here, because all of this is going to impact retirement. And you as agents and advisors are particularly well positioned to be there to help people, help clients navigate these tricky times and bring your skills and the great services, the great products that you represent to the table. Because that's what it's going to take for people to get not only just through the current economic situation, but to get to a secure retirement in this country. It's more challenging now to get to retirement, live in retirement today than it's ever been. And Retirement Genius is really dedicated to working with consumers and working with advisors as an information and resource hub to help people achieve a well-balanced retirement. We're dedicated to this every day. We're out there talking in the media, talking around the country, doing webinars, working with agents and advisors to help them understand and bring to the table effective tools for financial planning, health and long-term care security, and lifestyle enrichment. Because as we say with Retirement Genius, it's about bringing these three elements together to create a well-balanced retirement that everybody deserves, everybody wants to live in. And when you can bring these elements together, you will retire like a genius. So let's talk about the perfect storm that's hitting right now and what that is doing to set up the current environment that I want to spend time talking about today. Really what we're living in right now is a convergence of economic, political, and demographic factors that are putting a huge bite on particularly people when it comes to their retirements. As I was saying, the ability to save for, live in a secure, well-balanced retirement is more difficult now than ever. And it's economic conditions, it's political realities, and it's demographic factors that have all come together the way a perfect storm does in an unprecedented way to put us where we are today. So let's talk about some of these events, the current situation impacting seniors in retirement. Well, the most current inflation numbers that came in June showed a 9.1% inflation rate since the year before. And that's the highest it's been in 40 years. Now, the Federal Reserve has been acting as they are supposed to try and get that under control. What the Fed doesn't want to see happen is that inflation puts in its roots and it becomes accepted as part of the economy. They are going to fight inflation and push it back. And in so doing, their most effective tool, which they're going to use and have been using and have already used, is interest rate hikes. And The projection for the next interest rate hike, which will be announced tomorrow, is 75 basis points. It's also projected out to expect another 50 basis points in September and 25 basis points in December. So, you're looking at a full 150 basis points on top of what we've already seen this year for 2022. And that being said, economists are still projecting out that there's a good chance we will see a recession sometime over the next 12 to 18 months. Many are predicting it'll be more mild, better managed, but we will see the full cycle of an economy that was doing great and really has felt the impact of COVID. I would say if I was going to put my finger on one smoking gun, one culprit of what has rocked our economy, it's been COVID. And it's just had a huge disruptive factor, not only in the United States, but across the world. And there are other elements of what's impacting our economy that we can't control through things like interest rate hikes that are beyond our borders. But for what we can control, this is what you'll be seeing happening over the course of this year, because what the Fed are targeting is to get a inflation rate down to 2%. They want a 2% target rate. And what economists are projecting is getting it down to maybe 8% level. And then by the end of 2023, down to a 3.1% level. The next year, a 2.5% level, still above the Fed's target, but I think any of us would take 2.5% over 9.1% that we experienced in June. So let's look at some of the demographics and some of the financial realities about retirement right now. Who's saving for retirement? Well, we have 17% of our population is 65 and above. That's 55 million Americans are 65 and above. By 2025, that's in 2.5 years, the baby boomer boom starts turning 80 years old. Now, the average amount in U.S. retirement accounts is $65,000. And if you're going to retire and replace your income, because for many, the simple definition of retirement is you stop working, you stop producing an income, and now you're living on savings, investments, and things like Social Security. Your goal in retirement should be to know that you can replace 70% of your pre-retirement annual income, really at your highest income levels. To do that, if somebody started saving for retirement at the age of 35, they would need to be saving 24% of their income to on average to hit that mark. And if they waited till the age of 45, they would need to be saving almost half of their income to reach that mark. So these are really high threshold levels, and quite frankly, why it's so important to be saving and investing right from the get-go. I mean, from the first job in your 20s, the power of saving and investing, compound interest, tax deferral cannot be underestimated. In this country, the personal saving rate is 13.5%. So almost half of baby boomers are now retired. 74% of people expect to continue working during retirement. And as I said, baby boomers start turning 80 in the year 2025. One of the biggest factors that impacts people's retirement is health and long-term care costs. And so many people will ignore the impact of health and long-term care costs. So many people think it's something that's never going to happen to them. But the reality is, statistically, 70% of people over the age of 65 are going to need some formal long-term care that is going to cost money. And on average, a couple that would retire now, starting in the year 2019, at the age of 65, will spend almost $300,000 on medical costs in their retirement. Most people don't have that saved for retirement, let alone having that just to spend on health and long-term care type of costs. There is the safety net of Social Security. There's currently 52 million people age 65 and above that are collecting Social Security. You can qualify at the age of 62, but it's always smart to wait as long as you can before you start taking your Social Security benefit. The longer you wait up to the age of 70, the more you'll be collecting on a monthly basis. Half of households in this country rely on Social Security for half of their retirement income, and a quarter of households in this country rely on Social Security for 90 to 100% of their income. And that's pretty rough when you consider the national average Social Security monthly payment is just shy of $1,600 a month. And I don't know, I mean, good luck living on $1,600 a month. And the government is paying attention to this. They're paying attention to the savings rate. They're paying attention to these factors. They're paying attention to the stresses on these social safety nets. On the one hand, you have Social Security paying people's an income benefit, but what about healthcare? In the year 2020, this country spent $4.1 trillion on healthcare expenses. Medicare covered $829.5 billion. Medicaid covered $671.2 billion. Private health insurance spent $1.2 billion. And Americans spent out of pocket $388.6 billion on healthcare costs in this country in 2020. Now, there's 64 million people enrolled in Medicare, 88 million people enrolled in Medicaid. And what is a real stress on Medicaid is the consumption of Medicaid dollars on long-term care expenses. 5.5% of the Medicaid population is consuming 34% of the Medicaid dollars on long-term care expenses. That's a huge stress on the system and on taxpayers who are paying for all of this. So let's talk about legislative initiatives, because like I said, politicians are paying attention. Washington, D.C., and in all state capitals. And in the years I worked in Washington, D.C., healthcare and the baby boom crush was always a huge agenda item. And that was projecting out years in the future. Now we're living in the middle of it. It is happening as we speak. It's one thing to project a hurricane out to sea that's way off in the distance. It's another thing to be living in it as it's hitting your shores. And this hurricane is hitting the shores now. So some of the legislative activity that's going on to try and address and help people better prepare for retirement, better prepare for the eventuality and costs of long-term care. Let's go through some of what's happening right now in Congress and in the state. First, a major piece of legislation that will be very impactful to particularly to agents and advisors is the Secure Act. Now, the Secure Act has passed the House of Representatives overwhelmingly, in fact, and it's now referred to the Senate. And if it were to pass the Senate, it would be passed into law the very day it hit the president's desk. Some of the key features of the Secure Act that I've got listed out here is, one, this creates an automatic enrollment into a 401k plan for employees, which would contribute 3% of their salaries. And then that would escalate up to eventually 10%. Now, employees can opt out, but they would be opted in as soon as they signed up for payroll. They would then have to elect to opt out to get out of this automatic contribution to 401k plans, which, as I've always stressed with everybody, if you can put money into a 401k plan, you should be maxing that out. Get all of your pre-tax dollars into your retirement account, and every matching dollar an employee potentially could be putting in as well. They're going to be increasing the age and amount for catch-up contributions. So somebody at the ages of 62, 63, and 64 can increase what they're putting into their 401k at $10,000 in those years. They're also going to push out the age for the required minimum distribution, which is currently 72, and they're going to increase that to the age of 75 so people could keep their money in longer, growing longer before they started tapping into IRAs, 401k rollovers once they're retired. Another nice move is people who are burdened with student loans could receive matching contributions to their loan payments, like as if it were a 401k plan. And there's going to be a opening up of more annuity options inside 401k plans that people could be contributing to investing in. So the Secure Act is a major piece of legislation that will have a huge impact on retirement saving for employees and employers in this country. Medicare has made some strong moves to try and rein in costs for taxpayers and for Medicare beneficiaries. One of the big areas that Medicare surprisingly has not had the authority to handle, but there's now hopefully movement to get this in place, is allowing Medicare to negotiate with the drug companies to lower the cost of prescription drugs. Imagine Medicare, the biggest provider of payer of healthcare services in this country, can't negotiate with the drug companies today. Well, this would allow them, give them the authority to negotiate for better pricing with the drug companies. It would also allow Medicare to cap out out-of-pocket costs at $2,000 for anybody on prescription. So right now, some seniors end up out of pocket $8,000 in out-of-pocket costs. This would cap that at $2,000 and would also tie the increase of drug prices to the rate of inflation. So if the rate of inflation hits the target next year of 3% or 3 to 4%, a drug company couldn't increase the cost of their drugs by more than that without it costing them penalties. And then CMS is also going to reduce the Part B premium increase they enacted in 2022 in 2023. So there'll be a reduction in that premium increase, which was excessive in 2022 because it was tied to an experimental Alzheimer's drug that everybody had to pitch in on, that it ended up not being the right move. It's going to be corrected in 23. Now, this year in 2022, there was one of the largest Social Security cost of living adjustment increases in decades, enacted at 5.9%. But with the way inflation's going right now, you're looking at a much higher increase again in 2023, between 8.9 and 10.5% based on current projections. We won't know what it is, or even if it is, until next year, early next year. It is discretionary that Social Security can enact a COLA increase. They do not do it every year, but they did do it this year, and it's just looking very likely that they'll have to do it again next year as part of the damage control from inflation, and particularly how hard that hits seniors. Another interesting piece of legislation is the WISH Act, which is currently in the subcommittee on Social Security. This is intended to help people access long-term care insurance coverage. And what it's going to do, what it would do is create a new federal long-term care insurance trust fund that would be paid for through a payroll tax of 0.3% on workers and employers. So more opportunity, particularly for agents and advisors that work in the area of senior care planning, long-term care, more money, more incentive for people to be planning for their future needs when it comes to long-term care through this legislative act currently under consideration. Another area that has had a lot of growth and acceptance over the last decade has been the LTC life settlements. And that's an area I'm proud to say we've worked very hard on. We've helped draft legislation and regulatory rules. We've helped get, we've done testimony. We've done all kinds of education work. We've been on Capitol Hill trying to get the legislators to understand it is much better in the interest of not only the policyholder, but of taxpayers, that if somebody owns a life insurance policy, that they're no longer going to keep, that instead of abandoning that policy by either lapsing it or surrendering it, if they could access a higher value through a life settlement, its higher secondary market value, and use those funds for long-term care, it would delay the need for somebody to go on to Medicaid. It would save taxpayer dollars, and it would give the individual more control, more choice, and also help prevent their family members from having to dig into their own pockets to pay for this. Now, the National Conference of Insurance Legislators endorsed this back in 2010 and actually authored, which we helped them with model legislation that has been reviewed by states and Congress. The NAIC, the National Association of Insurance Commissioners, in 2017 then endorsed and released a paper talking about LTC life settlements and how it can help people pay for long-term care, which now has a piece of legislation on Capitol Hill that we've helped and been involved in, to create a senior health planning account, which would be very much like a long-term care HSA, exclusively funded by a life settlement. So this would give people tax-free use of their money through a life settlement if they were to put it into a dedicated account, a senior health planning account, that would be used to pay for their long-term care services. So we're hoping that we'll see this move over the next year or two. We're all watching how challenging the environment is on Capitol Hill now, certainly much more challenging than when I was there. But nonetheless, things will eventually move and get done. And when Congress sees a way to save taxpayer dollars and help people address the shortfalls of long-term care and retirement planning, this is certainly a very strong bet that this could move forward over the next year or two. Then there's the AGE Act, which is in the Senate Finance Committee right now. This is recognizing that family caregivers are one of the biggest providers of care in this country. And it comes at a big economic cost, not only to the family, but to the country, in lost productivity, lost wages, lost taxable dollars. So this would provide some financial relief for those family members who are providing care by creating a tax credit for their loss of income and out-of-pocket costs if they're providing care for an aging relative. A very important piece of legislation addressing a huge dynamic in this country. And I'm going to bet there are people on this call right now that they either themselves personally or people they're working with are dealing with this very situation. And you know how frustrating it is when a family member all of a sudden becomes like a full-time caregiver or a part-time caregiver, but they're uncompensated. And in fact, they're losing money doing it. But of course, you're doing it. It's for your loved one. You're going to do anything for your loved one, but they shouldn't be punished for that. They should at least be helped and made whole for the incredible effort they're giving to provide care for a loved one. Then there's the Washington Cares initiative, where we all have watched over the last year in Washington state, the mandate that requires people to purchase long-term care insurance through a government program or opt out of it by purchasing private insurance. So the government coverage would be funded by a payroll tax that would be levied against the employee unless they were able to show that they had bought individual private long-term care insurance. Now, this sort of, call it a pilot, was put in place in Washington state. And the data that came out of it was fascinating, because what it showed was a threefold increase from the previous year of people purchasing private long-term care insurance, and an incredible lowering of the age of people that were buying the coverage. Typically, people who are buying long-term care insurance are in their 50s and 60s, all of a sudden they saw a huge spike of people buying it in their 30s and 40s. So, pros and cons. Washington State, I feel, has been smart about this because they've looked at where there were holes in what they were doing, where they missed some things, they made some adjustments. And other states, a number of other states, are watching this and considering this also as an approach to how to incentivize people to take action to provide for their own financial security, as opposed to waiting till the end and then becoming a burden on the state. Because if you go on to Medicaid for your long-term care, and as I pointed out, 5.5% of the people on Medicaid are consuming almost 35% of the Medicaid dollars, and that's going towards long-term, very expensive long-term care costs. So if you don't provide for your future, you're going to spend yourself down into poverty, become a ward of the state, and now we, the taxpayers, are paying for your care. So there's never been a better time for action, and we're seeing it now. We are seeing the economic numbers rolling in. We're seeing it happen in real time. We're watching the cycle of the economy as interest rates rise. We've been watching for recently gas prices going down. There's a number of factors that are working their way through. It's probably going to be another year or so that we're going to be in this, but we'll come out the other side of it. We have gone through recessions before. We're not in a recession yet, but good chance we could end up one. We've gone through bear markets. Those correct themselves. Recessions are corrected. This will be corrected. And it's a good time right now, based on action that's happening politically and in the private sector as well. And Americans need to understand how important it is, what they need to do to secure their retirement and their future, by giving people more incentive and access to savings vehicles, investment vehicles, and ways to secure their future, so that their retirements aren't destroyed by undersaving, underinvesting, and then being wiped out by the cost of long-term care. And you, as agents and advisors, I've always said, are among the best positioned professionals out there to help people navigate through this and access the right platforms, the right vehicles to secure their retirement, to secure their long-term care future, to put themselves in a position where they're building a well-balanced retirement, and then they can retire like a genius. And that's what we focus on every day with Retirement Genius. So I want to invite you to get a free copy of our latest Retirement Genius tip sheet about politics and economics, an insider's view on how this is impacting retirement. Give our team a call at 888-627-3735. You'll have access to all this information. And for those of you on today's webinar, or if you registered for today's webinar, you'll get a follow-up email from our people with a recording of the webinar. As always, we encourage you, reach out. We want to work with you. We want to talk to you. We want to set you up in the Retirement Genius system. Go to advisors.retirementgenius.com. Sign up today for information and to join the team. We'd love to get you appointed and be part of the Retirement Genius family, working with us to educate people, give them information, and get the right resources into their hands for their retirements. And there's nobody better to be doing that than you. And we hope we can be there as one of your valuable partners and bring you tools and information you can do to help people accomplish those goals. So visit our website, retirementgenius.com. Follow our podcast, Retirement Genius. We're a Forbes book podcaster. Wherever you get your podcasts, you'll find the Retirement Genius podcast. And again, go to advisors.retirementgenius.com. Sign up, join us, work with us. You'll get lots of valuable information, and we look forward to you joining us on our next webinar and us staying in touch and talking to you soon. Thank you, everybody, so much for joining us today.